Have you ever noticed subtle shifts in someone's demeanor as they grow older? Perhaps a loved one becoming a little more set in their ways or less eager for new adventures. It is natural to wonder what changes are just part of the journey of life and which might signal something more. While some minor psychological adjustments can occur with age, significant personality and mood changes are, generally not, considered a normal or expected part of the healthy aging process. Your core personality traits tend to remain stable throughout adulthood, even into your later years. Drastic or sudden alterations in how someone thinks, feels, or behaves often point to other underlying factors. The brain is an incredibly adaptable organ, and it does undergo structural and functional changes over time. However, healthy aging typically preserves your fundamental emotional regulation and personality. Minor shifts might include becoming slightly more cautious or introverted, but these are subtle adjustments. When we observe noticeable changes like increased irritability, persistent sadness, apathy, paranoia, or a sudden loss of interest in hobbies, these are often red flags. Such alterations can be symptoms of various medical conditions, including treatable issues like depression, anxiety disorders, medication side effects, or even early signs of cognitive decline. If you or someone you care about experiences significant or persistent shifts in personality or mood, the most empowering step you can take is to discuss these observations with a healthcare professional. Keeping a brief record of when these changes began, their nature, and how they impact daily life can be very helpful for your doctor. This proactive approach allows for a thorough evaluation to identify any potential causes and determine the best course of action. It is important to remember that many conditions that can affect mood and personality, such as depression or anxiety, are highly treatable, especially when caught early. A comprehensive neurological assessment might also include checking for vitamin deficiencies, thyroid imbalances, or medication interactions, all of which can contribute to mood and behavioral changes. Understanding that these shifts are not simply an unavoidable part of getting older opens the door to effective interventions and improved quality of life. Ultimately, maintaining stable emotional well-being and a consistent sense of self is a vital component of overall brain health. By recognizing that major personality and mood changes are not a normal consequence of aging, you are empowered to seek appropriate medical guidance, ensuring that any concerns are addressed thoughtfully and effectively for a healthier, happier future.